Let's begin our discussion on today's issue. Joining us via Skype is the Health Department's Deputy Director General, Dr. Anban Pillay, the South Africa Medical Research Council's President, Dr. Glenda Gray, and social analyst Tessa Dooms. Gentlemen and ladies, thank you very much for your time. Dr. Pillay, can I start with you? Just listening to those latest numbers from the past 24 hours, is the Health Department's comfortable still that the move to level 2 of lockdown has come at an appropriate time?
Yes, I think we look at the statistics over a period of time, at least the last 7 to 14 days. And what you will see over that period is that there's been a decline in the number of cases. We've seen a decline in the number of hospitalizations, as well as a decline in the number of deaths. So I think we're certainly on the downward trend in terms of the curve, but we still need to be extremely vigilant because the virus is in no way eradicated, and transmission can continue to increase if we let down our guard. So from our side, we're certainly still comfortable with level 2, but I think we need to continue to be extremely vigilant because we're in no way eradicating the virus at this stage.
Now, if the trend of the decline began some time ago, Dr. Gray, should have level 2 come sooner?
I think it's hard to say. I think we needed to see the death rates come down. And we only started to see the death rates come down last week. And this week we see it continues to come down. So with the reducing of the death rates and the indication that the hospital beds were manageable, it became the right time to open up to go down to this lockdown. So I don't know if we would have been able to go down earlier because of our death rates, and now I feel with the reversal of deaths and our death rates coming down in all the provinces besides one, it's a good time to begin to open up the country. I also agree that we have to be very careful. We are going to continue to see infections. We're still going to see community spread. And the most important thing for us is not to have a resurgence or a second wave. And so we have to implement our non-pharmaceutical interventions. We have to be vigilant, wearing our masks in public, washing our hands, and keeping distance, and particularly improving congestion and improving ventilation in schools and other areas. So it's critical that we continue to implement non-pharmaceutical interventions. Don't let your guard down. We're seeing in other parts of the world, particularly amongst young people, that they are starting to see increases in outbreaks amongst 15 to 24-year-olds as these youngsters and adolescents get tired of being at home and they have COVID fatigue.
Now, Tessa, do you believe South Africans have got the discipline to remain vigilant and not be complacent?
I think, Dan, it's less a matter of vigilance and more a matter of education and information. I think one of the things that we haven't gotten entirely right in our COVID response has been very clear, comprehensive health messaging. And as much as we've heard stay at home, wear a mask, wash your hands many, many times, I think that there are layers of health messaging that can improve people's ability to respond and adhere. And so people understanding more about how COVID-19 is transmitted, I think more health messaging on that level would be useful. I mean, there's still people in the country who refer to COVID-19 as just another flu. Or as part of influenza, and saying, well, we've always had flu, so why is this so different? And so until we get to the point where we have mass public messaging that allows people to think through why these actions are important, as opposed to being told what to do, understand why they're doing it, I think we'll see more people behaving better. I think that to call it ill discipline is to not think about what we are putting in as people who are giving messaging, and to think about the circumstances in which people are living their lives and whether that too is conducive to adherence.
Better messaging, better education. Before I get a response from you, Dr. Pillay, listening to that input by Tessa Dooms, let me just advise you, we have been joined as well now by the President of Business Unity South Africa, that's Mr. Sipho Pityana, but I'll get to him just now. Dr. Pillay, how do you respond to that? Tessa is making a point that one of the biggest challenges for us to maintain and contain the spread is better education.
No, I certainly agree. I think we have to identify the target groups that require improved education or different messaging. I mean, the lessons from HIV is that we can't use the same messaging approach for all targets. So we know that there are people across the country who believe they won't get COVID, for example. They're somehow immune to that and believe that it's only others who would get it for certain reasons. And I think we need to target those and try to deal with those myths. We know in HIV, we've had over 2 decades of HIV messaging in South Africa, and we still know there are people who believe they won't get HIV despite understanding how HIV is transmitted, for example, would continue to adopt risky behaviors. So I think we need different messaging for different groups. We can always improve that, and we must keep understanding what is it that's driving those behaviors and ensure that they have adequate information and knowledge that would persuade them to change their behaviors.
Okay, let's welcome Dr. Pityana. Good morning, Dr. Pityana. You're joining us having just shortly after starting our discussion this morning on today's issue, just to understand where we are at with level 2 now of lockdown. And we're going to be talking later on about how do we mitigate the risk going forward. But from a business perspective, we've seen largely welcoming statements that it's the right time, but it's too early to celebrate for business, is it not?
Well, thank you very much, Dan. Indeed, we've had a very tough period with the lockdown. Businesses have taken a knock as well as jobs, but we've been supportive of government's initiative to focus on the health response because that was immediate challenge. It was always we're always aware of the fact that there were going to be consequences for both employment and jobs. So, indeed, the approach of life and livelihoods is the one that we subscribe to. Everything that is done must be driven by, must be evidence-led decisions, and they must be based on advice of experts. And we think that we've been very fortunate as a country to have health experts both from the public and private sector working together to govern that response.
But it's a very difficult balance, though, the one of saving lives and livelihoods. At some times, one would feel that business is pushing for a resumption, was pushing for a resumption of activity much earlier.
Well, it's a difficult balance. I have to say that our discussion in business has always appreciated the importance of the primacy that has to be placed on saving lives. The pursuit of profits and saving businesses and all of that is secondary, and we hope that the two can be attended to in tandem, and a delicate balance have to be managed. Of course, there was a credibility gap when there were somewhat arbitrary decisions that were taken that didn't seem to make sense, and that began to undermine the credibility of the strategy and raised questions about the efficacy of some of the approaches employed, and that was always going to happen because as we were all agreed about the importance of saving lives, there was always going to be an importance in ensuring that we are all at the same place in regard to why certain decisions are taken and not others.
Okay. Now, Dr. Gray, just listening earlier to Tessa and Dr. Pillay's response around how do we make sure that going forward, you raised the issue of a second wave, how do we make sure that South Africans actually adhere to the regulations? And she was saying that we need more education, not just the message that have been coming across. We need to improve on those. From a scientific basis, what should change?
Well, I think it's a difficult situation that we face because for a lot of people, they'll be asymptomatic or not even know that they have COVID. But for a group of people who are old and have comorbidities, having COVID-19 is a devastating and tragic event. And so, on the one hand, you want the people who are going to be well to protect those who are going to be vulnerable. And so, some of the messaging would be about, I wear my mask to protect you. I wear my mask. I social distance and I clean my hands because I don't want the elderly citizens in our country, our grandparents, our vulnerable people to get infected. And so some of the messaging is about I protect myself to protect you, or I do these interventions to protect the other citizens in my country, and trying to find messages. I agree that there'll be different messages for different people, because at the one level we do want the economy to open up, we do want our schools to be open, and we do want to protect the people in the economy and in the schools who are vulnerable. But at the same time, we do know that younger people are less likely to have adverse events from COVID. So it's a difficult message to get across, because on the one hand, for some certain groups of the population who get COVID, they're going to be fine. But on the other hand, there are others that'll die or have a tragic outcome. And so it's hard to message that in a way without people getting confused about it. So
yeah, how do you become targeted, and which audience do you address, and at what times? I think those are important questions to answer. We're going to continue our discussion, because one of the big ones is, how do we mitigate risk going forward? I'm asking this while we are seeing this decline in the numbers, which has made government to feel comfortable to drop the level to level 2 and open up most economic activity. There's a warning that we could face a second wave. So stay with us. We'll continue to discuss this with Dr. Anban Pillay, Mr. Sipho Pityana, and Dr. Glenda Gray, and Ms. Tessa Dooms shortly here, as we explore further today's issue here on ENCA.